Thank you for joining me to present an overview of the multidisciplinary perspective in advanced practice in the treatment of wounds, stoma, and continence care in Latino America. At a glance, Latin America is a group of 27 countries. It has a great geographical and biological diversity. It contains virtually all climates in the world. It also has a lot of energy and mineral resources among oil, silver, copper, and lithium. We can recognize three types of economic systems in Latin America: capitalism, for example, Chile; protectionism, for example, Brazil and Ecuador; socialism, for example, Venezuela and Nicaragua. The average life expectancy varies between 70 and 80 years old. Most spoken languages are Spanish and Portuguese. However, within these territories, a multitude of American languages are spoken with or without an official recognized status. Latin America is rich in culture and gastronomy. Latin America is in a constant fight against drug trafficking, corruption, guerrillas, poverty, and less developed economies. Constant migration causes major obstacles when fighting poverty, firming social cohesion, and improving health in the region. 30% of the population in the region have a lack of access to health care services for financial reasons. 21% have limitations due to geographical barriers. The groups most affected are vulnerable populations, which include children, elderly, ethnic minorities, migrants, and patients with chronic diseases, among others. The increase in population, aging, and patients with chronic diseases require the intervention of more trained professionals at all levels of care. What is happening to the nurses and doctors in Latin America? 1 in 4 nurses in the world are in the Americas region. However, about 57% of them, almost 3 million, are in North America. Thus, while in the north of the continent, there are about 110 nurses per 10,000 inhabitants, in Latin America, there are only 13 on average. In the region, the distribution of doctors varies by country. For example, Argentina, Cuba, and Uruguay have the highest proportion, between 40 and 70 doctors per 10,000 inhabitants versus 127 doctors per 10,000 inhabitants in North America. Doctors in Latin America, as in other regions of the world, tend to migrate to the practice of specialized medicine and high specialty hospitals, moving away from primary healthcare services, which creates a void in this level. COVID has increased the lack of access to be attended to in a dignified way. The hospitals do not have sufficient capacity of healthcare professionals. They are tired, sick, and even dying, causing the shortage of healthcare professionals to worsen in Latin America. Due to the lack of sufficient professionals in the different areas in Latin America, the Pan-American Health Organization, also known as PAHO, and World Health Organization, also known as WHO, proposed to expand the roles of nursing in advanced practice, APRN, and participation in interprofessional health care teams. PAHO and WHO considers the APRN as a professional with postgraduate training who is integrated into the interprofessional team, a professional that validates basic knowledge and practice competences, in our case, for advanced practice in wounds, stoma, and incontinence, supporting the fortify of care in these areas. This is not new. We already have international experience. For example, chronic programs, management of people with diabetes, wounds, stoma therapy, such as Europe, Australia, and North America. The essential competences for the APRN are education, investigation, experiences in clinical practice, organizational, and professional developments. What happens with the practice of wound care, ostomy, and continents in Latin America. Now we are going to talk about education, NGO, technology, and industry. Advanced education and care is not equal in Latin America. In some countries, it is very advanced, while in others, it is quite basic. There are contrasts in Latin America. In Brazil, Mexico, there are implemented courses, masters, and doctorates in these areas. In Colombia and Chile has implemented courses, whereas in other countries such as Nicaragua, Bolivia, Paraguay, this type of education is really poor. Latin America has been growing despite its limitations, and NGOs and government interests that are trying to respond to this need for attention, both in prevention and in direct care. There are Latin American organizations and federations of sepsis, abdominal, diabetic foot, stoma therapy, incontinence care, burns, among others, both of professionals and patients. However, there is not an equal development in some countries. There are no organizations focused on wounds, stomas, nor incontinences. Technology and industry are not equal. In some countries, such as Brazil and Mexico, skin is cultivated and other products are being developed. Besides this, both countries have technology for treating patients with these wound conditions. Nevertheless, the latest generation of medical supplies are not easily accessible in these countries in comparison with Europe, North America, and other more developed countries. Comely's mission is to form a Latin American collaboration network that facilitates the optimal care and adequate treatment of patients with wounds, stoma, and incontinence through educational programs, clinical practice, research and development, establishing positioning strategies in the public policies of each country in national and international initiatives. Comely core values are interprofessional participation with professionals of Latin America, interprofessional education to promote advanced practice development and improve healthcare, collaborative practices, professionals, families, and patients, investigation in Latin America in addition to exchanging experiences and project with partners of the world, like their JWC Latin Journal. There are also working with universities and other organizations that help to include patients and nurses with multi-professional groups. Latin America has many problems, but a lot of potential. Given the deficit of professionals, PAHO and the WHO promote the role of nursing in advanced practice. Education and technology is present in a non-equal way in Latin America. Some more advanced, others very basic and limited. There are organizations focused on different specialties, some uniprofessionals and other multi-professionals. Comely is an interprofessional Latin American alternative which promotes educational programs, clinical practice, research and development in our countries. Thank you for your time.